All right, so welcome everyone to the April Behavioral Health Advisory Group meeting. Thank you so much for joining us today. We are excited to have some presenters today, as well as convene you all to hear about all of the behavioral health resources that are taking part in Prince George's County. So continue to use that chat function to introduce yourself. I'm going to go ahead and advance this slide here. And for our new members who are joining us, if you would like to go ahead and introduce yourself, and we have a prompt that is, I will put up on the screen here in just 1 second. If you have a movie, a song, or any piece that you have to improve your mental health or something that you call upon that has had a positive impact on your mental health and which you would like to share. And I can kick us off here. For those who I've not met yet, I see we have a few new faces joining us today. My name is Taylor Palmer, and I am a health policy analyst with the Prince George's County Health Department. And I have to admit, I am a Swiftie. I am looking forward to the new album coming on Friday. And so I use that to feel good. And with the weather getting nice, it's been nice to just get to listen to some music and enjoy this weather on some nice walks.
Thank you, Taylor. I'll go next. My name is Margaret Fowler, and I'm one of the co-chairs of the meeting and work for Totally Linking Care. And my mindful minute is I'm very blessed to have a son that's a singer and a songwriter. So I listen to him on the music on my I guess I have it on my hard drive. So I listen to him when I want to be inspired.
And I see, Dominique, you have your hand raised.
Hi, good afternoon, everyone. My name is Dominique. I'm with Volunteers of America, and I really like Pharrell's song Just a Cloud Away because it reminds me that the rainy days may come, but they're just temporary and the sun's around the corner.
Thank you. Welcome. We will have to make a BHAG soundtrack.
Yeah.
Everyone, put in the chat if you're a Spotify or an Apple Music user. Anyone else who would like to introduce themselves? All right, well, we will get into our April agenda here. So we just finished up our welcome and introductions. Next, we have a partner presentation from Hazel Health. We'll hear from Miss Cheryl regarding the Fund Maryland 988 update. And as always, we will discuss some community announcements and any upcoming meetings, and then we will adjourn for the Wednesday afternoon. All right. Maria, I will pass it over to you. I will stop sharing my screen and allow you to share any content you may have from Hazel Health.
Thank you so much. Really appreciate it. Excited to be here with everybody. Let me share my screen really quick. I don't have a ton of slides, but sometimes visuals are helpful. I know they are for me. So I've got some slides ready. Sorry, guys, I'm not super well versed in Teams, so let me know if things are popping up for you. Okay. Can you all see my slides?
We're not
it's blurry.
Nope. Nope. Okay.
Not yet.
Let me try again. How about that?
Yes, we can see your
Yeah,
map.
Yes.
better.
Much better. Okay, great. Thank you for the feedback. I'm glad I asked. Well, my name is Maria Jose Norrero. I go by MJ or Maria Jose. Either one is fine. I am the Director of Partnerships with Hazel Health. Really excited to be here with you all. We have been serving children in Prince George's schools for, I believe, almost 2 years now. So our partnership with that school district and school system has been a pretty long time now, and I'm excited to share a little bit more about the services that we offer through our partnership with both the Prince George's Health Department as well as the Prince George's County Public Schools. Feel free to jump in and ask any questions throughout. Don't be shy. I might have a harder time keeping track on the chat since I'm managing the slides, but Taylor, just stop me if someone has a good question in the chat, if that's possible. Thank you so much. Appreciate it. So for those of you maybe who aren't aware of who we are, Hazel Health is one of the largest and most trusted telehealth solutions for K through 12 schools. We are in 14 states throughout the US, including Maryland. And our services are provided to students regardless of insurance status, immigration status, or their ability to pay. Through our partnership with school districts, as well as being able to bill insurance for services, we are able to deliver our services to children at no cost to them. So there's no out-of-pocket cost for kids. And the services that we offer, which I'll go into a little more detail, are both mental health and physical health. And those appointments are available to families both at home and at school. We're really proud of the staff that we employ. All of our services are delivered via telehealth. We do not have any in-person services, and our therapists are locally licensed, so they're licensed in the state of Maryland to provide services to Maryland children and families, but they're located throughout the U.S. And one of the things that allows us to do is be able to add capacity to a community, as well as be able to provide a group of therapists that are diverse, that are very representative of the communities that they serve. And so one of the examples that we have here is that 50% of our providers are identifies people of color. They consider themselves people of color. And we have 28, I don't know why this is saying California, sorry, but we have, I got some help getting the slides together and I didn't notice that was specific to California, but apologies. But we have over 20 languages spoken within our provider group, and about 40% of our providers are bilingual in more than one language other than English. So all of that to say is that we have a diverse group of providers, both on the physical health side and on the mental health side. And we're really proud of that. And here are a few photos of some of the folks that work on our team, and as well as the different license types and experiences that they have. But they're all directly hired by Hazel. So we do not contract out work. We don't have a contractor that kind of just does the staffing. They're all directly hired W-2 employees for Hazel Health. So what can folks expect, school districts expect from a partnership with Hazel? We do mental health services, physical health services, and we do provide care coordination support for families and students that need support beyond what Hazel offers. Normally what that looks like is long-term care, as well as psychiatric care, medication management. Those are the most common ways that reasons that we connect families out that have received services through Hazel's mental health service. I did want to provide a little bit of insight. I know this is a behavioral health group specifically, but I did want to share a little bit about the physical health services that we offer. And the reason I bring it up is because oftentimes the students that are being missed who have mental health concerns by kind of the school counselors or school social workers sometimes show up, with a routine stomach ache or a headache in the nurse's office. And so I always like to highlight that by having both services available, we often can uncover mental health needs that have just, are going under the radar, or just student doesn't have the vocabulary to be able to express that that's what's going on. And so it's manifesting itself in that oh, I just have a tummy ache, I don't feel well, I want to go home, I have a headache. So I always try to mention that we do provide that opportunity to kind of uncover mental health concerns that might be going through the health offices. So here are some kind of common reasons, common things that we can help with. We do consider ourselves a tier 2 intervention when it comes to mental health. We are seeing, because of sometimes lack of local capacity in our communities, we do sometimes flex into tier 3. That's why you see kind of this box bleeding over a little bit into tier 3. We will definitely provide support to any referral that's sent to, Hazel, and we can always connect to additional care if it's not the right fit, if telehealth just isn't the right fit, or if the student just requires some additional support. Here's kind of what the website looks like. I wanted to provide a little bit of I'm going to skip this one. So our mental health services specifically, we receive referrals from school staff that have identified a need among their students, the children that they serve. The referral comes into Hazel, and we reach out within 48 hours to the family to be able to gain consent if we haven't gotten consent already, and be able to schedule them in for their intake and assessment. We commit our commitment for all of our district partners, including Prince George's County, is to be able to, when we reach out to that family, be able to have at least 3 appointment options available within 2 weeks. We usually say 10 to 14 days, but just depending on the time of year, as you all know, sometimes there's some seasonality that causes more need, especially with schools kind of coming back in and that kind of thing. So within 2 weeks, we can make an intake available for a family who's ready for services. That intake includes a behavioral health assessment, all of the typical assessments that you would see, the PHQ-9, the GAD-7, those types of screeners. And then and then services begin, right? So the therapeutic appointments begin. And those therapy appointments can happen at school or at home, depending on the availability or the scheduling needs that the family has. And one note is that parents can join those appointments that are happening in school virtually. So they can still take part and participate in those appointments, even if they're not happening in the home. And then our family resource managers provide support for ongoing care. So typically, even though we bill ourselves as a short-term mental health services model, I'll tell you that on average, we see kids for about 6 to 8 visits, sometimes flexing upwards if that community has longer wait times. And so kids need to stay on before they can, really get connected to their kind of long-term provider or provider of choice. But 6 to 8 visits is the average. That doesn't mean that we cap at 6 to 8 visits. So I want to make sure that that's, clear. I see a question that came in about self-referral, only for students who meet the age of majority. So that's 18 years or older. Right now, any kids that qualify for like minor consent or that would have to be up to the county, the school district, to be able to make that available to students. So at this time, I don't believe that those are available in Prince George's County, but I can always check with our local teams to make sure that I'm right about that. But our family resource managers provide services for long-term services as well as additional services. And we do check in 6 months afterwards to see kind of what were the results of their outreach or if they need any additional support. And I'm going to go into a little bit about how we connect to local resources. This explains a little bit of what I just chatted about, so I don't think we need to belabor the point. So for care coordination, there are about 40% of students will receive a referral for long-term care. So 40% of the students that Hazel sees will say, yes, I'm interested in long-term services, or the therapist has identified that they should probably continue services or continue additional services beyond Hazel. So of those 40% of students, our family resource managers provide them 2 options, really. One of the options is, hey, here are some 3 options based on your insurance, your need, what the therapist has shared with me. what you've shared with me as your preferences to connecting to care. Here are 3 options. You can reach out on your own, or we do have direct referral pathways where we can send the email directly to the community organization, and we've set up that relationship. They know kind of who we are, they know what information they're going to get, and then that partner is expected to reach out to the family. As you all know, getting families connected to care can be difficult sometimes, and right, they just say, oh, I'm interested now, but then they don't make the phone call, or they make the phone call and then it's really hard to reach back out. So we prefer to send as many referrals via direct referral pathway as possible, because we know that that's what's good ultimately for the student and family to get connected to care, but we don't always get that option, right? It's up to families to tell us kind of what their preference is, and we don't always have a direct referral pathway set up with the organization that is like the best fit for the family. So those are 2 ways that we connect families to additional care in their communities. And here's a long list of the community partners that we have listed kind of in our inventory of options. We know that we could always add more to this list. So if you are interested in reaching out and getting connected to us, we are always looking for additional partners, and we are very conscious of the needs that you have for kind of meeting the needs of your clients. We want to make sure that we're making good matches, right? That's part of the value that we bring to a community, is hopefully helping match need being identified by our amazing school partners and school staff, and making the right match to the community organization that makes the most sense, right? That will, can bill their insurance and can see that age and can meet the needs of that child and is seeing patients, doesn't have to turn the family away. So we want to make sure we're sending families to the right place. And that's all I have. I'll stop sharing my screen, but definitely open to questions. If I missed any questions in the chat, please let me know. I can dig in. Looks like Larry has his hand up.
Oh, yes, thank you. I'm so sorry. I think my camera is not working. I'm Larry Epp from Shepherd Pratt One. Thank you for listing us as a community partner. I was curious about your medical services. I have 2 kids myself, and I was wondering, how do you do differential diagnoses of strep throat or pink eye or earache through telehealth? I'm just curious about that.
Yeah, I'll try my best. I'm not a physician and not on our medical team, but I can certainly get you more information. So for strep throat, we do not offer testing. That is something that we have explored, as we think it would be valuable to our school partners and our families to be able to offer, actual testing. So strep is definitely something where our provider would probably say, listen, it could be strep based on what I'm seeing in his throat, based on kind of the information I'm getting, but you need to go into a provider in person to get tested to rule that out or to definitively say. So that's one example. So our providers can sometimes get right up to diagnosing, but we'll always defer when they can't make a 100% call. For things like pink eye, that one's pretty clear based on visuals that we can see, and they can prescribe antibiotics to get that child started on antibiotics as soon as possible so that they can return to school, right? The whole goal of having school-based services is to aid in reducing the time that a child is away from school and be able to get them connected to care as quickly as possible. For things like earache, some of the things that I've seen is the provider will request that the family call back, within a day or 2 if symptoms haven't improved or if symptoms have worsened. So all of that is kind of aided in being able to definitively say this is an earache or this is something that may require you to go to in-person services. So it's amazing how much our providers can do via telehealth. I'll tell you that our iPads are equipped with ways of taking, photos of the inner ear and some additional devices like temperature, blood pressure, all kinds of things. And through the partnership of our amazing, clinicians that are in the schools, both health aides, health clerks, and nurses, together we can definitely get to the root of a lot of issues of why kids are not feeling well. I hope that answers your question, Larry.
Yeah, no, it's really interesting. That is a really valuable service. I just had one other question. I'm so sorry. So your service was sort of conceptualized as 6 to 8 sessions. Is there a reason for that? Why is it set up that way?
So, like I mentioned, we're not capped at 6 to 8 visits. That's just the average that we see kids. We've noticed that in 6 to 8 visits, about 60% of the kids that we see feel like their goals have been accomplished, their therapeutic goals have been accomplished. They're not in crisis. They're able to mitigate, symptoms and be able to really feel supported and feel well enough to not need additional support. So that's what the honestly, we benefit from being able to serve kids across 14 states. I think we're, we cover about 4 million kids. That doesn't mean that 4 million kids are seeing visits, but given this large data set, we can feel really comfortable that what we're seeing isn't just applicable to Maryland, but it's applicable to all students that we're serving via telehealth and via our model. So that's like I said, it's not capped. That's not how we were designed. We were always designed to be short term, knowing that getting kids the help immediately and as quickly as possible, we know that there's a huge value in that. But we know that eventually children should, have a long-term provider, adults as well, right? That have ongoing mental health needs. They should have a long-term provider. It shouldn't be someone that they just see once in a while via telehealth.
Great, thank you so much.
Of course.
Maria, this is Courtney Reed. I'm a nurse practitioner at Prince George's Health Department. I had a curious question about you guys' location. Are you guys ever at schools that have an on-site school-based wellness center? Or if not, how do you guys collaborate with the schools that does have them on-site?
We love when our district partners have in-school, school-based health centers, and we do collaborate. I will tell you that it looks different depending on the district and depending on the capacity of that school clinic. So for example, we work in Houston. I'll just give you an example outside of Maryland. I hope that's okay. But in Houston, we have a hospital system that has a really robust school-based health centers, but the district still felt like they wanted the Hazel as an option if, for example, the clinician is out that day, or if the clinician is at capacity, or some kid, the clinic can do strep testing, can do well checks, can do so much more than we can do. So why bog them down with just a kid who missed an allergy medication that morning? And so all they need to get is little over-the-counter medication back to class, right? So really, we collaborate both with the school-based health clinics as well as the district to decide what is the best workflow. Who do you want to send to Hazel and who do you want to send to the clinic? Or maybe it's not a good idea to have Hazel in place. It seems that's confusing. We don't need to have it in place in the places where there's a really great clinic with a really good relationship with the, school health office, and they have the capacity to see anyone and everybody. They're not, they're fully functional all days of the week, etc. So I hope that answers your question, because it can look a little differently, but we always try to be good partners both to the clinic and to the district partner. So we can, all three of us collaborate on like, okay, on Mondays and Wednesdays, the clinic's closed. So it makes sense to have Hazel as a backup option. So let's train that person. But otherwise, the first choice should always be the clinic that's there in person, right? Another example is many of these clinics sometimes do like STI and those kinds of things. We don't do that. So there's always opportunities to kind of make sure we're filling gaps and serving the best way possible, right? We don't do well checks. We know that's a great place for the in-person clinics to do, to do that work.
Yeah, awesome. I love this approach. Thank you.
We definitely try not to be one size fits all, because every services and resources look different in every single community. So we want to make sure that we're adding value. So yeah, absolutely, Carmen. I'll put it in the chat right now. Thanks for that reminder.
And Kim.
Yes, thanks, Taylor. Hi, Maria. I'm the manager of the Healthcare Action Coalition. I just have a question. You mentioned that you do referrals for more long-term services. If you were to identify a different crisis, like a housing insecurity or a food insecurity, do you have processes for referrals for that as well?
We do. I will completely transparently admit that we don't focus so much on social determinants of health, like for referrals, but if they're identified as they relate to accessing services or during a visit, you know, for example, if that stomach ache is probably related to hunger, we will dig in, we'll work with the school nurse or whoever's on the other side of that visit to say, might be something else going on here, maybe some food insecurity. You know, how can I work with you and the family to get them connected to care? So oftentimes we do have the insurance navigation is a common one. The food insecurity is another common one. Transportation to get to an appointment, if that's something that, you know, families have mentioned. I'd love to get connected to long-term care, but I just, you know, it's really hard for me to get there. Those types of services. Happy to have others, you know, verified on our list of referral resources if there's other ones out there. But we did want to mention that usually when we make those referrals, it's related to something happening in the visit. We're not out of our way serving for SDOH. I wish someday we could, and hopefully that's on the roadmap sooner rather than later because I think it's important. But right now, that's kind of how we handle referrals to those types of services.
Thank you.
Yeah, absolutely. Great question. Well, I think that's all the questions folks have. If you have additional questions, my email's in the chat, and please feel free to reach out. We have a team that loves to get connected to more and more partners. We try to have all the different options that families could ask for on our list. Please don't be scared of reaching out, even if you just want to learn more and you don't want to be on the list yet. Maybe you're still deciding. That's okay. We'd love to chat with you more, and we really appreciate this time.
Thank you so much, MJ, for hopping on today. It is great to see you already connected so much with many of the spokes through the Maryland Consortium grant. And if the BHAG can support you guys in any way during that grant period, please do feel free to reach out to us.
Yeah, we're lucky that we were already delivering services before the grant came along, right? So it was really quick, easy to get right back to work. So appreciate it.
Great. Thank you so much for joining.
Taylor, sorry, one more thing. We also are in Charles County, Maryland. I know some of our organizations work in a lot of different counties. So just wanted to throw out there that through the grant, we're working with Charles County, Baltimore City, and Queen Anne's. And if your services are available there, or you have partner organizations that you want to refer to us, we'd love to get connected to them as well.
Thank you so much. All right, and I will be sure to include contact information in the meeting notes as well. All right. Hopping back over to our meeting slides here. I will next tap on Miss Cheryl's shoulder for some wonderful news.
Certainly. Good afternoon, everyone. I'm hoping everyone hears me just fine. It's been 3 years in the making, this announcement that we have regarding the success of getting 988 through the state legislature onto the House floor, and it's passed. It's on its way to the governor's desk. Let me just read you something very short here. Senate Bill 974 and House Bill 933 have officially passed out of the Maryland General Assembly and are headed to Governor Moore. This is an incredible milestone for the many coalition members who worked throughout this period of time to get us to this success. We're going to be meeting shortly as a coalition this coming Friday, as a matter of fact. There's probably going to be a bill signing ceremony. And we certainly want folks to know that those who were supportive and are supportive can certainly join us. I'm hoping everyone knows that the bills that I just mentioned were all about the fee that is going to sustain the pot needed to provide this service to anyone who needs it. here in the state of Maryland. And you know, of course, our state is a part of a nationwide network. So this is incredible. And I must say that as a program director with the Black Mental Health Alliance, our program links providers of professional services with those persons who need those professional services. We know from firsthand experience how invaluable 988 is. And now with this permanent source of income or resource, we can now build this network out and really give people the incredible help that they need. So again, thank you, everyone. It feels good to have a success. I'll pass it back to you, Taylor. Thank you so much. Any questions?
Cheryl, I just want to say congratulations again. I know it's been a lot of hard work and a long, long journey. And I know that it'll help improve a lot of the things that we need to help get that rolled out in Maryland. One thing I would like to maybe put on your radar, because I've been working with 911 and 988, and one of the things that maybe can be looked at is that we find with our 911 call specialists, people keep calling our 911 call specialists because it's free and they're being transferred to 988. So I don't know if there's anything on the horizon that could, what is that pathway to get 988 free, just like 911? But I know that that's been one of the things we've been tracking with the 911, 988 diversion project.
Actually, the 988 crisis number is a number that anyone can call, and to my knowledge, it is free. There is no cost.
Well,
and
I'm sorry, it's on the cell phone. On the cell phone, they can't call 988 like an emergency number. Because I think
the structures.
Yeah, so I don't know. I'd love to see and would be willing to support in any way I can, getting 988 a free call on the cell phone. Because I think
there is going to be discussion this coming Friday with the coalition members as to what will be our next steps. It's been 3 years in the making, so you're taking these things a step at a time. And since we've got now the permanent source, then the point that you raise is one that should be put on the agenda.
Well, thank you. Thank you for considering that.
Any other questions? And do me a favor, drop that in the chat just to make certain that I can recall exactly your question. Okay? We want to make certain we bring it to the attention.
Thank you for that, Ms. Cheryl. We appreciate all your
You're
hard
welcome.
work. And if there's anything
all
the
of
work
our
group can
hard
send out.
work.
Yes. And I know Carlos was unable to join us today, but also want to give a congratulations to him as well, and a big debt of gratitude for all of his hard work as well, and the broader coalition as well.
Okay.
All right. Well, we will go ahead and jump into some community announcements. So first, the upcoming Gapbuster Incorporated ribbon cutting and open house. We'll hear from Gapbuster next month in a partner presentation. They are also a consortium grantee doing some excellent work in the county regarding youth mental health. So they have their upcoming grand opening and ribbon cutting ceremony on Wednesday, April 24th at 5 p.m. I will share this flyer out in the meeting notes, but is anyone from the Gapbuster team on the call with us today? Okay, I think they were unavailable today, but I will be sure to share this out. But again, another great partner and another great spoke that's coming from the consortium. They'll be doing some great work moving forward for youth mental health. Next, we have from the University of Maryland Capital Region, the Violence Intervention Program. They are having an upcoming wellness fair on Saturday, May 4th from 2 to 6 p.m. And this will be all about violence prevention, CPR training, driver safety, infant car safety, fall prevention, fire safety, health screenings, and violence prevention. And you can register with this QR code here. And I will be sure to share this out as well with the meeting notes. Next, we have a virtual event coming up. This will be a virtual town hall to discuss the allocation of resources within the proposed FY25 budget. This will be on Wednesday, April 24th at 6 p.m. And we will share this with the meeting notes to register. And again, this is a virtual town hall meeting. As you can see, they are calling on mental health professionals in particular to participate in this event if you are able to join. And thank you for putting that in the chat, Kim. And lastly, I have this here for the Greatest of All Time Expo coming up on May 18th at Bowie State University. I believe Dominique had earlier shared about the event. And so here is the registration link again on Saturday, May 18th, if you are available to attend the GOAT Expo. And with that, are there any other community announcements?
Yes, may I?
Absolutely.
Thank you. My name is Carmen Rivera with the State's Attorney's Office, and we're having tonight a wonderful event for teenagers of the ages of middle and high school. The program is called Que Pasa, and it's a virtual event where the teenagers have the opportunity to ask questions. It has to do with behavioral concerns, public safety in the schools, and fentanyl, sorry. So if anyone would like to attend, if you don't mind, give me your email address and I'll send you the flyer and the link to participate. Or I can get somebody's email address and forward it so you guys can forward it to all the group that are participating today.
Absolutely. Thank you, Carmen. I will put my email in the chat if you're able to send that to me as well.
Thank you so much.
Thank you. All right. Any other community announcements or any upcoming activities going on in the community? All right. Well, be sure to continue to share any events that you have coming up, and we will share those out to the BHAG. Our next BHAG work group meeting will be on Wednesday, May 15th. But of course, let us know if there's anything you need in the meantime. And thank you so much for joining us, everyone, today.
Thank you, Taylor.
Thank you, everyone.
Thank you.
All right, bye-bye.